Lauren, thank you very much. That would be Bruce Anderson. First of all, thank you for being here. Good to see you.
Thanks, Howard.
Let's get right into some of the details. You saw those numbers that keep spiraling on a daily basis, but truth be told, do you think those numbers are grossly underreported from what the reality really is?
Howard, I'm afraid they are. There are tens of thousands of cases, and the health assessment systems in China are not what they are here.
Right.
So it's undoubtedly an underestimate of the number of cases of illness and also deaths. From all we know, China is still the epicenter of this outbreak, but cases are occurring all over the world.
We have no cases here, knock on wood, nothing confirmed, but we do have about a half dozen people in self-quarantine. I assume that you wouldn't be surprised if that person that may be patient number one is already here, already on the ground, and it's a matter of time. Again, that 14-day incubation period, you wouldn't be surprised when it shows up, if it shows up at any time?
There's 6 other states that have reported cases, and every day we're hearing about more. There's a 14-day incubation period, so when we do see a case, there's probably other cases. But we haven't seen one here yet. In fact, we don't have any cases even under investigation yet. But this virus is spreading very rapidly, and I'd be very surprised if we didn't see a case here and in most states across the country in the next weeks.
China, when you look at what's happening in the Wuhan province, as you said, the numbers may be grossly underreported, but some very significant actions are being taken by the government there to really rein in that population that's right there at ground zero. Kind of some of the information we're hearing is downright scary.
Yeah. Hubei province is on lockdown. I mean, they're welding shut doors. They're not letting people out of homes, isolating people there. So that I do have some concerns just about whether they're going to be getting food and
water, medicine, basic supplies,
everything else. I'm sure they're doing the best they can, and they obviously take this situation very, very seriously.
So let's take a look at the more surrounding areas that a lot of Hawaii people do travel to and from. Hawaiian Airlines, other airlines still travel on a daily basis, several flights to Japan, to South Korea. Obviously, all on the continent there, do you think it's a matter of time before it kind of explodes? Obviously, I think it's safe to say it's going to get worse before it gets better. But what about those neighboring communities, neighboring countries?
I think everyone's in the same place. People are moving still between countries. It is spread person to person. I think extraordinary precautions are being taken. Here in Hawaii, we're greeting every international plane, and we're checking them for travel history. If they have any history to China, of course, we're treating them specially. They're isolated if they are, and most countries are doing that. So everyone's trying to restrict the spread of this disease right now, and they're doing everything they can to do that.
Okay, I want to talk about the spread of the disease, because a lot of the cases that are, as we keep counting them, they're people that were together in the Wuhan province, or it's a husband that gives it to a wife, vice versa. It's people in close proximity. Even if somebody is infected and you just happen to walk past them in an airport, the likelihood of that person infecting you is very low.
Yeah, think of it as the flu or a cold. If you're close and someone coughs and sneezes on you and you're very close, there's a possibility of exposure.
Gotcha.
But the human-to-human exposure we've seen here in the United States has been husband and wife and people who are intimately in contact or in close contact. But that's not to say that we shouldn't be careful. You still need to wash your hands.
Gotcha.
You need to cover your mouth when you sneeze.
Okay, I got one more for you.
Yeah.
Okay, the people know I don't really wear a pocket square. Okay, it's not. It's a mask. We were talking about this earlier. Pretty clever, right? This you say, if you feel better wearing it, it's not really going to do much, right?
Yeah. I don't wear a mask. I don't have one on me.
Okay.
And I wouldn't recommend one.
Okay.
Howard, the masks are really effective if you're sick and you want to keep someone else from getting sick.
Gotcha.
It is not thought to be protective from viruses. They can come around the side of the mask, and the mesh, believe it or not, and the paper is not sufficient to keep you from inhaling a virus. So it's better, if you're sick, you want a mask.
Sure.
If you're not sick, it's probably not going to protect you, but people wear them because it's comforting, and it may be better than nothing.
Gotcha. Got to go. Appreciate it.
Okay.
Not a bad looking pocket square though, I got to admit. Yeah. Thanks for really cutting through this, and we'll have you back as things continue to hopefully get better before they get worse. All right, Bridget, you guys, back to you.